For KNEB and 19 degrees, about 40-45 this afternoon for a high. News Extra brought to you by Arends Civic Center. Here's Kevin Mooney.
Thank you, Dennis, and good morning, everyone. And our guests today are John Brehm. He's the Scottsbluff County Veterans Service Officer. Tom Arends is the VFW commander, and he also is the quartermaster, I learned today as I was talking to these gentlemen here before we came in. And we're going to talk about something you've probably heard a lot about on the news, and that's this controversy over Black Hills Veterans Health Care and the situation with hot springs and everything. And there's a couple of meetings coming up that maybe folks want to, kind of know about and put it on your calendars so you get a chance to comment on what's going on. So, John, I'll let you go first. Again, two meetings coming up. The first one coming up this Monday, right?
Yes. On February 13th, 2012, it's going to be at the VFW Post 1681 on the Gearing Scottsbluff Highway. The meeting is going to be from 6 to 7. Roger Limke, the Director of Military Affairs for Senator Mike Johans, will be in Scottsbluff, and he will be hosting the meeting. And what they want to do is we want to get as many veterans there as we can to talk about how the proposed maybe closure or making it an outpatient clinic at Hot Springs will affect them. And then on the 22nd, which is on Wednesday the 22nd, from 6 to 7, also at the VFW Post 1681, we're going to have another meeting, and that's going to be the Black Hills Healthcare. I'm sure the director will be down, and some of the other big shots from up there will be down, and they're going to give a public forum. And we'd like to fill that up too, and we want to have veterans there to voice their opinion as to whether they want it or not. I don't think it's a good idea myself, but everybody will make their own opinion on that.
All right, so the meeting on Monday, February 13th is 6 to 7 at the VFW Post, and then the other one on the 22nd, that's a Wednesday, 6 to 7 also at the VFW Hall. So for folks that don't know what the situation is here, why don't you describe it? It has to do with the Hot Springs Veterans Health Center and the fact that the VA is looking at closing that facility, right?
Well, they're not really going to close it. What they want to do is they want to change it. As I understand, they want to make it into a outpatient clinic, and then move a lot of the services up to Fort Meade, and that's another 75 miles up there. I don't think. What my problem is, it's working very well at Hot Springs. Why fix something that isn't broke?
Yeah. And part of what they want to do is have some of these services provided locally rather than having everybody go up to Hot Springs, which sounds on its face like a good idea, but there might be some issues with that, right?
Yes, I think so, because that's going to cost a lot of money, and then they're going to say, I'm afraid they're going to say, well, we don't have the budget for that at this time, so we'll have to do most of the services up at Fort Meade. Sturgis, South Dakota, but I can't say that for exactly, but I'm kind of suspicious.
Yeah, because that's what's happened in the past when they've tried to make changes like this, right? Let's let Tom get in on this. Do you have the same concerns, Tom?
Yes, but a lot of it is on the travel of the veterans that have to go up there. I know that
Fort Meade is quite a larger trip.
John said it's like 75 miles farther one way. Because we have, John lines up the DAV vans which transports them, so that'll put it at 2 extra hours at least of driving time on the volunteer drivers that transport people up there, so that makes it longer. Or if a person is driving up there by themselves, that's a lot more driving too.
That's a long drive,
right, yeah. And weather conditions, in the wintertime it could make it hard to get back and forth up there, so.
Yeah.
But,
so, what's the feeling of most of the veterans as they talk about it at the VFW hall?
Most of them were against the closing it down because they go up there and they get their services.
And they're comfortable with it, right?
Yes, and sometimes they have to take and stay, they take a bus from Hot Springs up to Fort Meade if they're going to have surgery and major stuff. But most of the clinic stuff is all done right there at Hot Springs. So, and they don't want like the other driving and that there. So, and the time wise it takes to do extra traveling.
Yeah. Yeah. Now there's a hospital in Cheyenne, and John was saying earlier, what do you think? About 50-50, 60-40 as to the number of veterans that go to one place and the other place?
I was thinking it's more 50-50, but John says it's more 60% go up to Hot Springs and 40% Cheyenne. So,
yeah.
And the DAV van goes there too at the same, usually the same days if they got people lined up and everything. So,
yeah. So, and the weird thing is, you go, well, okay, if they're going to close the Hot Springs one, why don't we just have everybody go to Cheyenne? But that doesn't really equate, does it?
No, some of them with the service they have up the Hot Springs, they used to it, and they like the doctors and that they have up there. Otherwise, they would have to go and get new doctors lined up and everything else like that. Because I know Cheyenne's also limited on doctors and that they have too, so sometimes it's hard to get lined up with a doctor if you're coming in new. So
yeah, okay. We'll talk more about this after this 30-second break. All right, we might talk about the fact that maybe they're making some of these changes before they're even announcing a decision. They're doing it.
Right, yeah.
They're actually doing it. We're back on News Extra today. We have John Brehm with us, the Veteran Service Officer here in Scottsbluff County. Tom Arends is also here, the VFW Commander here locally. We're talking about the Black Hills Veterans Healthcare situation and the fact we got a couple of big meetings coming up in the next couple of weeks. The first one Monday, February 13th, this coming Monday, 6 to 7 p.m. at the VFW Post, where you can talk to Roger Lemke, who is with Senator Mike Johans about this situation, as well as some other folks with Senator Johans. And then there's a big public forum coming up on Wednesday, February 22nd, 6 to 7 p.m., where you can actually speak with some of the VA Black Hills healthcare system officials about this situation with the closure of the, not the closure, but the change with the Hot Springs Veterans Healthcare Facility. Now, the changes they're talking about, John, to some extent, I've seen Congressman Smith talk about it. Other people talk about it. They're worried that the VA, even though they're saying they haven't made a decision and they're taking public comment, they're actually making some of these changes already without even announcing that they're going to do it, right?
Yes. I would say for the past 2 years, they've already started moving some of the services from Hot Springs up to Fort Meade. Like surgery, most of the surgeries are done at Fort Meade that I know of, and I know even a lot of the other procedures. Some of the X-rays and stuff are done up there with nuclear X-ray or testing is done up there only at Fort Meade, which they used to do it at Hot Springs. So they're just slowly moving it up there. And I think this has been in the works for a good 2 to 3 years.
Yeah. Part of the reason they say they're doing this is to save money. Isn't that what they're saying?
Yes, they want to consolidate. But I think what the master plan is, and within 5 years, I've heard this is not official, but within 5 years they want to close Fort Meade and build a big VA hospital at Rapid City, with the state of the arts and operating room and everything. And they figure why they figure it's good to have it there is because that's where the biggest population of veterans is in Rapid City.
Yeah, so basically what happens here, am I right, Tom, is that the veterans in western Nebraska are kind of the last thought of anybody in the Veterans Administration up in the Black Hills, because they're saying, well, that's not, there are a lot of veterans here, but compared to Rapid City, there's not as many, so the smaller population kind of gets messed up in this whole thing, right?
Well, and it's also South Dakota, so they're looking more for the South Dakotans' priorities than they are, say, Nebraska or even Wyoming.
Yeah.
It's even though those are close there and everything, but they probably are gearing more for the South Dakota people.
All right.
So.
All right. Real quick before we close, how important is it for people to get to these meetings, even though maybe the decision is a done deal? Hopefully it's not, but I think people need to get to them, right?
They should get to them, and then so they can express their opinion or get more details, so it's not just all rumors. They get more actual details.
Yeah.
Yeah.
Okay, get the facts as to what's going on, right?
Right. On the Monday, the 13th, and everything like that, the VFW also holds their regular meeting at 7 o'clock. So.
All right.
So there'll be extra people there. So.
Yeah. So just get there an hour early and make sure you express your views to the senators, folks.
Right. Yes.
At 6 o'clock.
Yeah, so.
All right. Once again, 6 o'clock to 7 on February 13th. On February 13th. February 12th or February 13th? 13th. February 13th, a Monday. Yes. This coming Monday, February 13th, 6 to 7 at the VFW Post. You can express your concerns to Senator Joann's folks, and then on February 22nd, Wednesday, 6 to 7 p.m., you can actually talk to the VA Black Hills folks. So get on out to those meetings. Thanks, gentlemen. Appreciate it.
All right. Thank you. Yeah.